I am Dr. Neelima Padmanabhan, obstetrician and gynecologist with more than 25 years of experience, specialized in cosmetic and functional gynecology. Hymenoplasty is a procedure where there is restoration of the hymen for social, cultural, or personal reasons. For many young women, this procedure brings peace of mind and psychological comfort, and we believe it is every woman's right to choose this procedure if she wishes to. In this procedure, the torn edges of the hymen are brought together and stitched, or a new membrane is created by using the vaginal tissue. The recovery time is usually 4 to 6 weeks. Labiaplasty is a procedure used to remove the excess tissue in and around the labia minora or majora. This is usually performed when there is discomfort for the patient in wearing tight-fitting clothes, or there is any asymmetry or irregularity or pigmentation. Labiaplasty is a procedure used to sculpt and even out the excess tissue in and around labia minora and majora. This is a procedure done in individuals who have discomfort during sexual activity or wearing tight-fitting clothes. It is also done in patients who would want to reduce the asymmetry or pigmentation or unevenness. The benefits of this surgery include improvement in self-esteem and feeling comfortable while wearing tight-fitting clothes or in sexual activity. Vaginoplasty is a surgical procedure that tightens the vagina. It is done by removing the excess loose vaginal tissue and tightening the supporting muscles and tissues around the vagina. The vaginoplasty is indicated in patients who have severe degrees of vaginal laxity following childbirth or any trauma. Recovery time takes at least 6 to 8 weeks, and during this time the patient should avoid sexual intercourse and strenuous exercises. Benefits of vaginoplasty include increased self-confidence and better sexual intimacy. The clitoris is a highly sensitive and erectile tissue of female. The tissue that surrounds and covers the clitoris is called the clitoral hood. Clitoral hood reduction or clitoral hoodoplasty involves the procedure removing the excess tissue surrounding the clitoris or covering the clitoral hood. The indications for this surgery are aesthetic concerns about the bulkiness of the tissue, reduced sexual pleasure because of the excess tissue covering the clitoral hood. Some of the benefits which the patient can have following the procedure are enhanced sexual arousal, increase in comfort while wearing tight-fitting clothes. Perineoplasty is a surgical procedure involving repairing and reconstructing the perineum. Perineum is the area between the vaginal opening and the anus. It is typically performed to restore the anatomy and function of the perineum following childbirth, trauma, or in certain medical conditions. Monsplasty is a procedure used to reduce and contour the mons pubis. The mons pubis is the fatty area above the pubic bone. This procedure is done when there is bulging or excess fat in the mons pubis area, or if the patient desires a flatter or more youthful contour. A liposuction or excessive removal of fat and skin is done in this procedure. The healing time is usually 4 to 6 weeks, and the final results appear in 3 to 6 months. If you undergo any surgical cosmetic gynecological procedure, you might have swelling, more pain and discomfort in the healing period. The recovery time is little longer compared to the laser treatment. There is increased risk for infection, bleeding, scarring, and adhesion formation. Sometimes they may not give you the expected results and can result in asymmetry. The results of cosmetic gynecology surgeries are usually long-lasting, but some factors might affect the longevity of these procedures. For example, childbirth following any surgical procedure can alter their surgical outcomes especially vaginoplasty or perineoplasty. Aging, natural tissue changes can affect the surgical outcomes. Weight fluctuations. Significant weight loss or weight gain can alter the appearance of genital area. Lifestyle choices. Smoking or poor health habits may accelerate aging or vaginal laxity. I am the medical director of Cure Care Hospital at Hormao, Bangalore. Our motto is affordable healthcare to all without compromising on the quality. Cosmetic gynecology or aesthetic gynecology is the latest and fastest growing subspecialty of obstetrics and gynecology, which focuses on the functional and aesthetic aspects of female external genitalia. Cosmetic gynecology at the outset looks like it is only for the rich and affluent class of patients. But we at Cure Care Hospital would like to break the myth and make it affordable to everyone.